takeaway here is that just because you have one bad habit, it doesn't mean that you have all bad habits as exhibited in the blue zones.
Right.
What's your takeaway from the fact that some people in the blue zone do smoke? Is it to say we should be smoking, we should be taking nicotine? What's your takeaway from that?
So what I take away from it is if you look at nicotine as a drug, first of all, it's addictive, as any tobacco executive knows. Mm-hmm. So even I don't recommend, like Dave Asprey does, taking nicotine drops and putting it under your tongue or wearing a nicotine patch. But I do think we actually have to look at whether or not nicotinic acid is a useful longevity drug. And you don't have to go very far to look at the literature looking at the various forms of nicotinic acid that are now available, like NNM or NR, nicotinamide riboside, that these have clinical published studies on their effects on uncoupling mitochondria. So give you a long, interesting story. I use niacin to treat my patients who make Lp(a), lipoprotein(a). It's very effective at lowering Lp(a). And I and others think that Lp(a) is one of the most important effectors of cardiovascular disease, certainly in family history.
What does niacin have to do with the...
Niacin lowers Lp(a) production.
No. How does that connect to the nicotine component?
Nicotinic acid is niacin.
Interesting.
I have to jump in on this because that's a very passionate topic of mine. I just actually moderated the major LPA session at one of our biggest cardiology conferences this year. And